Hi.
Hi, I'm Dr. Shruthi Reddy, Consultant Obstetrician and Gynecologist in Rainbow Hospital, Banjara Hills. So, whenever we have bleeding in pregnancy, generally we don't see bleeding in pregnancy. Whenever we see bleeding in pregnancy, first of all, we need to look whether at what stage of pregnancy the bleeding has started. So, if there is a bleeding in early pregnancy, first of all, we need to rule out whether the baby is in the right location. That means, are we dealing with an ectopic pregnancy or not? We need to rule out. And second thing is whether the baby growth is good or not. So if these two are seen and the baby is in the right location and the growth is fine, majority of the times the bleeding settles down. But if there is a bleeding which is continuously on and off happening in the pregnancy, in the early part, half of the pregnancy, then it can lead to growth problems in the baby, which has to be followed by a scan in the later part of the pregnancy. And the second reason for bleeding in pregnancy can be because of the placenta, which is going to supply blood to the baby. So when this placenta is located in the lower part of the uterus, that is called placenta previa. That can also cause bleeding in pregnancy, and that can be a painless bleeding, and sometimes it can be very dangerous to the woman and to the baby. So when this happens, you need to see the doctor and follow their instructions, and based on their advice, you need to continue the pregnancy. And the other reason can be when there is a high blood pressure, sometimes there can be a condition called abruption, where the placenta gets separated prematurely, and that causes bleeding in pregnancy, and that can lead to a sudden problem to the baby. So these cases can be prevented by a good control of blood pressure and a proper monitoring of the baby's growth in the later part of the pregnancy. Thank you.